Bancroft.
Thank you, Speaker. The Treasurer earlier today boasted about the cranes on the skylines around Toowoomba Hospital, but he cannot boast about what is happening at Redcliffe Hospital because nothing is happening. On Thursday, it will be 5 months since the LNP halted the building of that crucial Redcliffe Hospital expansion. Construction had already started on a 9-storey clinical services building. The piling foundations were starting to go into the ground. On the day that they announced the new Olympic Stadium and the new Aquatic Centre was the day that the piling contractor pulled out the last of their piling rigs from the Redcliffe Hospital site. Speaker, my team and I have been door knocking in the area, telling people about what the LNP is doing to our local hospital. And the hospital staff that we've been meeting, they've been telling us about what is happening. And what they are saying is this. They're saying that they're overworked and with overtime being slashed. They say the hospital is overcrowded with staff crammed in every available space and patients ramped up in corridors and places where they shouldn't be. It is clear now, Speaker, that we need the Redcliffe Hospital now. Our population is booming and putting pressure on this hospital right now. And we've not only been talking to local residents, my office has done some detailed statistical analysis of the public health data available for Redcliffe Hospital. What we discovered was this. There was a higher wait time over the past year, with 90% of patients waiting anywhere from 250 to 350 days to receive planned surgeries, compared to around 150 days a year earlier. 250 to 350 compared to 150. October 2023 to June 2024 had a median wait time of 145 days for planned surgeries at Redcliffe Hospital. October 2024 to June 2025, that median wait time has gone up to 285 days. Let me repeat that. Median waiting time for planned surgeries at Redcliffe Hospital has blown out from 145 days to 285 days under the LNP. This is how the LNP manages our local hospital. Speaker, Redcliffe locals feel that the Redcliffe Hospital has got worse with the LNP. That is what they tell me, and they are right. Not only have they cancelled a building project that would deliver the services that are needed now for this overworked and overcrowded hospital, surgery waiting times are starting to blow out at Redcliffe Hospital under the LNP. Locals are seeing through, they have seen through all the promises that the LNP have made about looking after our local hospitals. All they need to go to do in Redcliffe, go down to Recreation Street, have a look at the abandoned building site next to that hospital, and they can decide for themselves if they can trust the LNP and the LNP member for Redcliffe to look after their local hospital. And Speaker, that is not all. I've got questions about the planned car park expansion under the LNP. The multi-storey one opened in 2020 at a cost of $23.7 million. And I knew it from my briefings at the time that that car park allowed for an extra 3 storeys to be built on top of that, totalling 530 extra spaces. But now the member for Redcliffe has stated on social media the LNP have put out to tender a project to build just 2 extra storeys for 494 spaces. Now, the question is, why aren't they building it to the full planned capacity? What are the reasons? Is this a cut to the planned size of the extended car park? Is this another LNP cut and cancellation for Redcliffe Hospital? Locals want to know, why is the LNP only doing 2 storeys on top of this car park when the original design catered for an extra 3 on top? Locals are really unhappy about what is happening at Redcliffe Hospital. You don't need to go and find opinions. Wherever I go around the area, people stop me to talk about the Redcliffe Hospital and they ask what is happening and why. And all I can say is the LNP are in control of this. You need to go and talk to them. Our locals are not happy about what is happening at Redcliffe Hospital, the overcrowding, the overworked staff, the abandoned building site.